What if the pill bottle sitting on your nightstand right now, the one you take without a second thought, is quietly rewriting your brain? Not a street drug, not something exotic, something a doctor handed you with a smile and a take one before bed. I need you to sit with that question for a second, because by the end of this video, you may never look at your medicine cabinet the same way again. I'm Dr. Sanchez Santos. For the past 20 years, I've worked as a neurologist, which means my entire career has been spent inside the brain, diagnosing it, protecting it, and unfortunately, sometimes watching it fail. And here's something that took me years in practice to fully appreciate. Some of the biggest threats to your memory aren't diseases at all. They're prescriptions. Ordinary, common, everyday prescriptions. Here's a number to sit with. In a large study published in JAMA Internal Medicine, researchers tracking tens of thousands of older adults found that certain common drug classes were linked to significantly higher odds of a dementia diagnosis. In some cases, nearly 70% higher. 70%. That's not a rounding error. That's a signal your doctor needs you to hear. Tonight, I'm walking you through 9 medications. 9 categories most people over 50 have either taken, are taking right now, or have sitting in their bathroom cabinet. That research links to increased dementia risk. We're counting them down from 9 to the single most concerning one, so don't skip ahead, because the mechanism I explain at number 9 is going to show up again and again as we go, and by the time we reach number 1, it's going to click into place in a way that could change how you manage your own health. Before we get into it, I want to ask you for something. If even one person in your life, a parent, a spouse, a friend who's managing 5 different prescriptions, could benefit from this, hit subscribe right now and share this video with them. Not later. Now, while it's on your mind. This is the kind of information that's easy to forget by tomorrow morning, and the people you love are worth more than a forgotten good intention. Let's start at number 9, acid reflux medication. Specifically, a class called proton pump inhibitors, drugs like omeprazole and esomeprazole sold under names like Prilosec and Nexium. These are some of the most prescribed medications on Earth, often taken for years without anyone questioning why. Here's the mechanism, in plain language. These drugs work by shutting down acid production in your stomach. That's wonderful for heartburn, but your stomach acid does more than digest food. It helps your body absorb vitamin B12, a nutrient your nerve cells depend on to function. Long-term, low acid can quietly starve your brain of something it needs. Think of it like a delivery truck that keeps the correct address but slowly stops making deliveries. The house, your brain, still exists. It's just not getting supplied the way it should. A 2023 study published in the journal Neurology, following nearly 2 million adults, found that people who used these medications for more than 4 years had a meaningfully higher rate of dementia compared to those who didn't. Not a dramatic spike, but a real, measurable one. I want you to meet Walter. Walter is 68, a retired auto mechanic, the kind of man who fixed everyone's car in the neighborhood for 30 years. He'd been taking his little purple pill every morning for reflux since he was in his 50s, never questioned it, never had it reviewed. When his daughter brought him in because he was repeating himself in conversations, one of the first things we did was look at his medication list. We didn't stop the PPI overnight. That's not how this works, and I'll come back to that. But we started a conversation about whether he still needed it, and at what dose. Here's your action step. If you've been on an acid reducer for more than a year, don't wait for your annual physical. Call your doctor or pharmacist this week and ask one simple question. Do I still need this? And is there a lower risk alternative? That's it. Small step. Real difference. But PPIs are just the opening. What we're about to look at next hits people even more often, because it's sitting in nearly every household in America, and most people don't even think of it as medicine. Number 8, everyday antihistamines. I'm talking about diphenhydramine, the active ingredient in Benadryl, and in most nighttime cold medicines and over-the-counter sleep aids like Tylenol PM. This is the one that surprises people most, because it feels so harmless. It's sold right next to the candy at the pharmacy checkout. Here's the mechanism, and this is important, because it's going to come up again several times tonight. Diphenhydramine is what's called an anticholinergic. That's a big word, so let's make it simple. It blocks a brain chemical called acetylcholine, which your brain uses for memory and learning, the way a router relays a Wi-Fi signal. Block that signal repeatedly, over years, and the connection gets weaker. A landmark study out of the University of Washington published in JAMA Internal Medicine in 2015, followed thousands of older adults for years and found that the more cumulative anticholinergic exposure someone had, with strong antihistamines among the biggest contributors, the higher their dementia risk climbed. This wasn't a one-time dose. It was regular, repeated use, night after night, year after year. Let me tell you about Carol. Carol is 71, a retired school teacher, sharp as a tack her whole life. For over a decade, she took Benadryl almost every night. Not for allergies, just because it made her drowsy and she liked how easily she fell asleep. When her son mentioned she'd started forgetting appointments she used to track perfectly, we talked, and one of the very first changes we made was swapping that nightly Benadryl for a non-anticholinergic option. She told me, "I had no idea something from the drugstore could do this. This is not a minor drugstore habit. This is a nightly dose of something your brain has to work against." If you or someone you love reaches for Benadryl or a PM sleep aid regularly, tonight is the night to start looking for an alternative, not next week. Now here's where it gets more serious, because number 7 takes that same anticholinergic mechanism and puts it into a pill designed specifically to knock you out. Number 7, prescription sleep medications. The so-called Z drugs, like Zolpidem, known by the brand name Ambien, and similar drugs like Lunesta. These were originally marketed as the safer alternative to older sleeping pills. Safer for addiction risk, maybe. Not necessarily safer for your brain over the long run. Here's the mechanism. These drugs work on the same brain receptors involved in deep, restorative sleep cycles, but they don't produce truly natural sleep architecture. Over years of nightly use, that disruption to how your brain cycles through memory consolidation stages of sleep may chip away at cognitive reserve. Think of it as slowly eroding the riverbank that your memories are supposed to settle into overnight. A German study analyzing large-scale health insurance claims data, published in the Journal of Alzheimer's Disease, found that regular use of these Z-drug sleep aids was associated with a meaningfully higher rate of incident dementia compared to non-users. Have you ever wondered why your doctor keeps asking how long you've been on your sleeping pill? This is exactly why. Meet Frank. Frank is 63, a retired postal worker who'd been taking Ambien nightly for nearly 8 years after a difficult divorce disrupted his sleep, and he simply never stopped. When we finally did a full medication review, sleep hygiene coaching, and a gradual, doctor-supervised taper got him off it in 12 weeks. He still tells me his mind feels less foggy than it did a year ago. If you've been on a nightly sleep medication for longer than a few months, that's your cue to book an appointment and ask about a taper plan. Never stop cold turkey. We'll talk about why that matters in a minute, but don't let temporary quietly become permanent. Let's keep moving, because number 6 brings us to a medication class prescribed to millions of anxious, overwhelmed people every single year. Number 6, anti-anxiety medications, specifically benzodiazepines. Drugs like alprazolam, known as Xanax, diazepam, known as Valium, and lorazepam, known as Ativan. The mechanism here overlaps with what we just discussed, but the numbers are more striking. These drugs calm the brain by amplifying a chemical called GABA. Short-term, during a genuine crisis, that's a legitimate tool. But a landmark French study published in the BMJ, following over 1,000 older adults for 15 years, found that new benzodiazepine users had roughly a 50% higher risk of developing dementia compared to people who never used them. 50%. Let that number sit there for a moment. No medication, no surgery. Just a number from a real peer-reviewed study that should make every one of us pause before refilling that prescription without question. This is where I want to introduce you to Linda. Linda is 67, a retired nurse, someone who, ironically, spent her career administering medications to others. After her husband passed, her doctor prescribed lorazepam for anxiety and grief. What was meant to be a short bridge turned into 4 years of daily use. When her sister noticed Linda getting lost driving to a grocery store she'd shopped at for 20 years, that was the wake-up call. We worked with her physician on a slow, careful taper alongside therapy for the underlying grief, because you have to treat the cause, not just remove the pill. Here's your action step, and it applies to every medication we're covering tonight. Never stop a benzodiazepine abruptly. Stopping suddenly can be medically dangerous, even life-threatening. The correct move is to call your prescribing doctor this week and ask for a structured tapering plan if long-term use is no longer necessary. We're at the halfway point now, and I promised you these numbers would connect. Pay close attention, because number 5 brings us into medications for a completely different condition, but with the exact same warning fingerprint stamped underneath it. Number 5. Anticonvulsant medications. Drugs originally developed to control seizures, but now widely prescribed off-label for nerve pain, migraines, and mood stabilization. The mechanism: these drugs dampen electrical overactivity in the brain. That's exactly what you want if you're having seizures. But dampening brain activity broadly, over years, can also dampen the very networks responsible for memory formation. It's a bit like turning down the volume on a whole orchestra because one instrument was too loud. You quiet the problem, but you also quiet everything else. The same large Coupland study out of the University of Nottingham that we've referenced tonight, published in JAMA Internal Medicine in 2019, found that patients with the highest cumulative use of anticonvulsant medications had roughly 39% higher odds of a dementia diagnosis compared to non-users. I think of Harold. Harold is 69, a former electrician who was prescribed an anticonvulsant for chronic nerve pain in his feet from years of diabetes. He'd been on it at a steady dose for 6 years without a single medication review. When we finally reassessed his pain and function, we found a lower dose combined with physical therapy controlled his symptoms just as well, with far less cognitive fog. If you're on a long-term anticonvulsant for pain rather than seizures, that's a conversation worth having with your prescriber. Is this still the right dose, the right drug, for where you are today? Number 4 brings us to a medication class prescribed specifically to manage a condition that already carries its own risk to brain health, which makes this one particularly important to get right. Number 4, anti-Parkinson's medications, specifically an older subclass used to control tremors, called anticholinergic anti-Parkinson agents, drugs like benztropine. Here's the mechanism, and by now, this word should be sounding familiar: anticholinergic. Same blocked chemical, same acetylcholine signal, same weakened connection over time. But this time, in patients who are often already managing a neurodegenerative condition, meaning the cognitive cushion to absorb that extra hit is often thinner to begin with. That same Coupland research found this category associated with a 52% increase in the odds of dementia among the heaviest users. This is not me speculating. This is what shows up when researchers look directly at prescription records against real diagnoses. I want to tell you about Antonio. Antonio is 72, a retired mail carrier diagnosed with Parkinson's disease 8 years ago. His original tremor medication included an anticholinergic component that had never been revisited since his diagnosis. Working with his neurology team, we transitioned him to a newer combination that controlled his tremor with far less anticholinergic burden. His daughter later told me his conversations felt sharper within a few months. This pairs powerfully with what we're about to cover at number 2, because they share the exact same mechanism, just applied to a different part of the body entirely. Keep that thread in mind. Number 3, tricyclic antidepressants. Older medications like amitriptyline and doxepin still commonly prescribed today, not just for depression, but for chronic pain, migraines, and even sleep. Same mechanism again. These older generation antidepressants have strong anticholinergic properties, considerably stronger than newer antidepressant classes. That same JAMA Internal Medicine research found a 29% increase in dementia odds tied to anticholinergic antidepressant use. Here's the part that matters most. Newer antidepressants exist that treat the same conditions with far less of this specific risk. This is not you having to choose between your mental health and your memory. This is about making sure your doctor knows both goals matter. Diane is 66, a retired librarian who had been on amitriptyline for over a decade. Originally for migraines, a reason she'd honestly forgotten by the time we met. She told me, almost word for word, "I feel like I have my life back," after switching to an alternative that controlled her migraines without the same brain fog she'd quietly accepted as normal aging. That's the moment right there. The moment you chalk up forgetfulness to just getting older, when the real explanation might be sitting in your pill organizer. Don't accept that explanation without checking first. We are almost at number 1, and I need you to stay with me, because these final 2 carry the strongest evidence of anything we've covered tonight. Number 2, bladder control medications. Drugs like oxybutynin and tolterodine, prescribed for overactive bladder, one of the most common conditions in adults over 60. Same anticholinergic mechanism, but here's why this one lands harder. These drugs are frequently prescribed for years, sometimes decades, without ever being reviewed, Because incontinence is embarrassing to bring up, so people just keep quietly refilling the prescription instead of asking questions. The Coupland research found bladder antimuscarinic use associated with a 65% increase in the odds of dementia among the highest exposure patients. 65% tied to a medication millions of people take every single day without a second thought. Patricia is 68, a retired bank teller who had taken oxybutynin daily for 9 years for an overactive bladder. When we reviewed her medications after her family noticed short-term memory lapses, we found safer alternatives, including non-drug pelvic floor therapy, that controlled her symptoms just as effectively. Her memory complaints improved noticeably within 6 months of the switch. Here's your action step. If you or someone you love has been on a bladder control medication for more than a year without a formal review, that review needs to happen. Not because the drug is inherently dangerous in the short term, but because year after year of quiet exposure is exactly what these studies are warning us about. And now, number 1, the medication class with the strongest documented association of everything we've covered tonight. Number 1, antipsychotic medications, drugs like quetiapine and risperidone. Originally developed for serious conditions like schizophrenia, but increasingly prescribed off-label at low doses for anxiety, insomnia, or agitation in older adults, often as an easier fix than addressing the underlying issue. The mechanism combines everything we've discussed tonight: strong anticholinergic effects, sedation, and disruption of the brain's dopamine and acetylcholine systems simultaneously. It's not one blocked signal, it's several, all at once. That same major study found antipsychotic use associated with a 70% increase in the odds of a dementia diagnosis among the heaviest users, the single largest association of any medication class researchers examined. 70%. No medication, no surgery, just a prescribing pattern that's become far too common. I think about Dorothy often. Dorothy is 75, a retired seamstress, prescribed a low-dose antipsychotic off-label to help her sleep after her husband's death. Nobody sat down and explained what that medication actually was, or why it was different from a simple sleep aid. Her daughter told me she just wanted to sleep. Nobody told her what she was really taking. Working closely with her physician, we built a plan around grief counseling, sleep hygiene, and a much safer short-term option while we carefully tapered the antipsychotic. Dorothy is doing remarkably well today. I want you to pause here and think about your own medicine cabinet or your parents' medicine cabinet. Is there a small orange bottle in there that was meant to be temporary, that quietly became permanent? Before we recap, I need to hear from you. Drop your age in the comments and tell me, how many of these 9 medications are currently sitting in your own home? I read every single comment, and I promise you, you are not alone in what you're about to realize. Let's bring it all back together. Number 9 was acid reflux medication, quietly reducing a nutrient your nerves depend on. Number 8 was everyday antihistamines like Benadryl, blocking your brain's memory chemical nightly. Number 7 was prescription Z-drug sleep aids, disrupting the sleep cycles your memory needs to consolidate. Number 6 was anti-anxiety benzodiazepines, tied to a 50% higher risk in real research. Number 5 was anticonvulsant medications, quieting more of the brain than intended. Number 4 was older anti-Parkinson's drugs, adding extra burden to an already vulnerable brain. Number 3 was tricyclic antidepressants, often prescribed for reasons patients themselves forget. Number 2 was bladder control medications, refilled for years without review. And number 1, the strongest association of all, antipsychotic medications, often prescribed off-label for problems they were never designed to solve. Here's what I need you to understand, and please hear this clearly. I am not telling you to stop any of your medications tonight. Never stop a prescribed medication abruptly without talking to your doctor. Some of these, especially benzodiazepines and antipsychotics, can be genuinely dangerous to discontinue suddenly. What I am telling you is this: ask for a medication review. Bring this list to your next appointment. Ask your doctor or pharmacist, one by one, do I still need this? And is there a lower risk option? Your brain is not broken, and your memory is not simply fading because of age alone. Knowledge is power here, and the choices you make this month, the conversations you start, the reviews you request, are genuinely within your control. If this video helped you see your own medicine cabinet a little differently, hit subscribe, share it with someone who needs to hear it, and leave it in the comments so someone else scrolling past might stop and really read it. I'm Dr. Sanchez Santos, and I'll leave you with this: the sharpest mind you'll ever protect is the one you already have. Don't let a quiet prescription take it from you.